Hello, and welcome to the Magnetic Moment, which is our new talk series that we're going to be putting out over the next couple of months and or years. We'll be talking about who we are at Sonera and what we do and what we care about. I'm Amanda, head of strategy and operations here, and I'm sitting with Nishita, our CEO, which she'll tell you again in a moment. And we're going to kick things off with exactly what I just said. Who we are and what we do and what we care about. So some housekeeping before we get really started. Can you define a magnetic moment for me?
Ooh, that's housekeeping.
Yes, that's housekeeping.
Okay. All right, a magnetic moment, I'll give you like the slightly technical definition, but not too technical.
Yeah.
A magnetic moment basically describes an object's tendency to align with an external magnetic field. And so what that means is like if an object has like a larger magnetic moment, it has a greater tendency to align with that field.
Does that alignment equal how like strong it is magnetically speaking?
In some ways, yeah. Yeah, it's like a measure of that.
Okay, I'm happy with that.
Great.
So, who are you and what do you do here?
So I'm Nishita. I'm the CEO of Sonera.
Nice. Okay, so we'll just move on because that's a perfect answer. What are our mission and vision here at Sonera?
So our mission at Sonera is to make neural data ubiquitous. And so the idea is we want to be able to make brain activity as easy to measure as heart rate or temperature or a lot of these other physiological parameters that we kind of take for granted today as being really easy to measure. Mm-hmm. And then our vision at Sonera is to advance humanity by leveraging a more accessible neural data set. So there's a lot of different applications of that we'll talk about in a little bit.
Very cool.
Yeah.
I like that. That's why I work here.
Yeah.
What are we developing?
All right. So we are developing a new type of magnetic sensor technology. And we're using that to be able to measure biomagnetic signals from the body, but in a non-invasive chip form factor. So in a way that's very easy to integrate in lots of devices, and you can place it on the surface of the skin and be able to measure this type of activity in a very scalable way.
Okay. And what's a biomagnetic signal?
Yeah. So I'll actually start with talking about electrical signals, right? Everyone's really used to and familiar with reading electrical signals from our body, and that's what our body generates all the time through muscle movement, when we're thinking, through even when we're breathing, like we're constantly generating electrical signals. We measure things like EKGs, right? That's something that everyone's familiar with, or in smartwatches, you can measure ECGs as well. Something that people oftentimes don't think about is that those electrical signals also have a magnetic component, and they can be measured today with really bulky, expensive equipment. But that's something that's like not feasible, right, for wide scale use. And so what we're doing is we're trying to measure that magnetic component in a chip. Okay. And so it's really like the same type of biophysical phenomenon that we're used to measuring, but we're measuring a different component of it. So that's what a biomagnetic signal is.
And that bulky version of that today, that's like an MRI.
Yes. So yeah, imagine something as like bulky and big as an MRI. And there are other systems that people have been trying to scale and develop into smaller form factors, but it's still just not something that's easy to access today or cheap in the same way that electrical signals can be measured.
So nothing really commercially viable yet.
Nothing really commercially viable, effectively, yeah.
So let's talk about you for a little bit.
Okay.
I know you love that.
I love that.
When did you decide to take this idea from the lab to market?
So it was kind of a slow burn. There wasn't like a single moment when we decided to really take this from the lab to the market. I would say it was in my third year of grad school in like 2016 or so that I started working with my co-founder and CTO, Dom. We started working together as researchers to effectively try to scale and optimize these new devices that he was working on. And as we were working together, we started thinking more about the application space of the technology that we were building and got really interested in how we could potentially apply this in the real world, move it from basic research into something that was more of a product or something that people would actually make useful. And so then it was kind of, it was a sort of a slow burn. So we started together as researchers and then started talking about applications and what that could look like. We did this 1-week boot camp with the Haas Business School at Berkeley. Cool. And they had us interview 10 potential customers of our technology. The idea was to figure out whether there was actually something valuable there in the market.
Okay.
Based on what you were doing. And so being researchers, I think we interviewed like 10 scientists, which is like not.
I was gonna say, what customers were you talking
to? Like professors,
other
grad students. Yeah.
Okay.
So we interviewed our 10 customers.
Perfect job. Yeah.
But they were really excited about what we were doing. And so they were excited about what we were doing. And then we also were interested in like digging a little bit deeper into this. And so then we did this 2-month program with the National Science Foundation. That was the same thing, but you interviewed 200 customers. So that's when we went out and we went to conferences, interviewed a bunch of neurologists, other scientists, but also people in industry. It's the first time we started interviewing people in industry.
Perfect.
And asking about, whether our technology would be interesting for their application, or if they had a capability like this, what would they do with it? Yeah. And so kind of going back to what we're building, it's this the core technology is a magnetic sensing chip that can measure neural activity very easily and in a very accessible way. And so the big takeaway from that exploration with the NSF that we did is that there is this really big gap in neurotechnology and neurodiagnostics when it comes to really high fidelity accessible sensor technologies. And so there's this really big need to innovate in the sensor side and the hardware. And so that for us felt like a really good signal that, we should keep pursuing this and see where we go with this. So long story, but it wasn't really a clear moment when we decided to do it. We just kept getting stronger and stronger signals from people like that there was something interesting there to pursue, and we kept doing that. And then I guess fast forward after that, now we're 30 people on the team, raised almost 25 million across like venture and grants. And here we are today.
Here we are.
Yeah.
Have you always envisioned yourself as a founder?
No, I never envisioned myself as a founder, actually.
Okay.
And not at all. I thought I wanted to be a pediatrician for the longest time.
Okay.
I was going to be a doctor.
All right.
And it was in high school that I became a lot more interested in physics than biology. And so I wanted to study that and ended up pursuing engineering in undergrad and started doing research there and a lot of hands-on experimental work.
Okay.
And it was then that I started becoming more interested in just research in general, kind of working in the lab and seeing like what you could discover that wasn't previously known. That became really interesting to me.
Yeah.
And so did a lot of research on undergrad, and then that led to me pursuing a PhD. But I remember even when I was doing my PhD, I really had no concept of what it meant to like start a company or be a founder. Yeah. I at that point thought I would either pursue a faculty position, as many people do when they pursue a PhD, or become a researcher in a national lab or something like that. And so similar to the story I just told about it being a slow burn, my path to being a founder was a little bit of a slow burn. And it was during grad school that I became really interested in understanding how to commercialize basic research. How do we actually translate all these really interesting breakthroughs in science into products that are useful for people? Yeah. And that's something that there's still, I think, a really strong need for, and there's not a lot of people who are trying to do that, and there's not a lot of good funding opportunities for it. And so kind of in conjunction with the work I was doing with Dom, this kind of became a really good intersection for me to pursue learning that skill and also develop a technology that I thought could be really impactful and really useful at a larger scale. And so that's what kind of led to me becoming a founder.
There's a lot of like very interesting and transformative science and technology out there that just like never ever gets to market for so many reasons. Yeah. I think that's a really interesting like driver to get to be here today.
There's so much interesting work that never sees the light of day.
It's pretty crazy.
Yeah.
Out of curiosity, do you know why you liked physics more than biology?
I think the reason why I liked physics more than biology at the time, and I actually feel different about biology now, it's changed, but I think at the time, I think physics just felt like so fundamental to how the world operates in so many ways.
Yeah, literally.
Not that biology doesn't, but like there's so much physics in biology too. Yeah. And so to me, it just felt like this really interesting key building block to how everything in the world works. And so that's why I became really interested in it.
That's a very like refined and thoughtful answer, because I like physics more than biology, and my answer is because like biology you memorize stuff and physics you figure it out.
So that was actually part of my reasoning in high school at least. I was like, why am I memorizing everything?
The 10 steps of glycolysis were like haunting to me. So mine is, I guess I'm going to take your answer from now on because that was pretty good.
Basic research biology is interesting though, right?
So maybe I just didn't get far enough.
Yeah, neither of us did.
Yeah, dropped it real quick.
Here we are.
So kind of along the same lines, like what motivates you?
I think what motivates me is just curiosity about what's out there and what hasn't been discovered. Determining like what we can do that hasn't been possible before, and also figuring out if there's a way to scale those discoveries into something that can be really impactful and change the world. As cliche as it sounds, kind of going back to what I was saying about all these really interesting breakthroughs that never see the light of day.
Yeah.
I oftentimes think about like, what are all the things that we haven't discovered or done yet that could completely change and transform everything. So that's what really drives me.
Yeah. Yeah. I think, cliches are cliches for a reason.
Yeah, it's true.
Talk to me a little bit about like the team here and like how we do or don't motivate you and like the work that we're trying to do.
I think what's so exciting about, so it's now been 6.5 years that I've been running the company. And I think what motivates me so much about running the company internally is just seeing how much incredible work all of our team has done. Pretty much from the beginning, we were told many, many times that we weren't going to be able to accomplish what we've accomplished so far.
I heard some of that when I was interviewing.
A lot of it. And even today, I talked to a lot of people and they're like, we didn't think you would make it this far.
I know,
we didn't think you
so
guys
great.
would get here.
It's like, here we are.
Yep, we're still here. And a lot of that is because like the team is just phenomenal. And I'm constantly super impressed with how many technical challenges and just general like challenges they've overcome in trying to pursue this greater goal that we have, whether it's, figuring out how to improve the performance of our sensor, how to miniaturize the system, how to understand this new modality around biomagnetic sensing that we're pioneering in many ways for the first time. Everything is kind of unknown in a lot of facets that we're doing, but the team has taken that on and found a lot of solutions to it, and I think that's really impressive and really inspiring to me.
I think one of the things I noticed, like everybody here is so smart and so kind and so approachable, and it's like really a team. Like there's no like factions here.
Yes,
and it's not that easy to build a team of this size without any like secret factions that are somewhat warring. So a very impressive team. I'm
Thank you.
Obviously very happy here. What's the most surprising thing you've encountered in the last 6 years?
I would say the most surprising thing I've encountered is how rapidly plans can change. When Dom and I started the company, we actually thought we were going to be a medical devices company. And our goal was to build a portable brain sensing system.
Cool.
And so it's just a very cool thing,
yeah,
right?
I was like,
maybe
it's one day.
We will one day. We will one day, for sure. And I think it was like in the first few years that I realized there are so many variables in the market and externally and things outside of your control that you're required to adapt to keep the company alive and keep the company and the technology going, that you have to be really open to changing those plans and not be really set on anything and too rigid on anything.
Yeah.
And so that was to me the most surprising. Like the ideas that we had initially where we thought this would go have changed so drastically. And so it just requires a lot of adaptability and flexibility. And so like that's one example of like how we kind of changed our market goals. Another is with financing. Like you really never know what's going to happen with financing.
Yeah.
An investor that you think maybe would be the right profile for your company or team may not, and then somebody else comes out of the woodworks and ends up leading your round. That's happened to us. And so just how much things can change and how unpredictable the nature of company building is, especially in a frontier space.
Yeah. One of the things I've noticed, like, I've been here for about 6 months now. Sometimes our plans can change like hour over hour.
Yeah.
And it's not like week over week. It's like really, but another thing I've noticed is like you have this ability to like keep your eye on the 5-year ball so that like even though things are like changing day over day, there's still some like underlying stability that makes it much easier to deliver work and keep your focus and like drive towards a goal as opposed to like kind of like throwing a bunch of darts at the wall, which has been like a really solid way to move forward. So I was going to ask you if you always knew you wanted to pursue a PhD, but it's pretty clear that you didn't. So what I'm asking you instead is, can you talk us through a little bit about your PhD program and what you studied and how you ended up here?
Yeah, so my first foray into research was in undergrad, so that was my first taste of doing hands-on research. And I joined an optics lab, and I was working on building microlasers.
Microlasers?
Yes.
Tiny lasers.
Tiny lasers, exactly that.
Perfect.
Yeah. And that was my first time also being in a clean room.
We have one of those.
Yes, we do have one of those, yes. And so that was my first time, again, doing like hands-on experimental work. I really enjoyed it, and that's what led me to kind of want to stay on that track and pursue hands-on research for my PhD. And so came to Berkeley for grad school, and I started actually working on batteries. That was the first project I worked on.
I think batteries are very cool.
They're a very cool technology. I did not like the project at all.
Not for everyone.
At all. Okay. And so I worked on it for a year, and ultimately I told my advisor I wasn't enjoying it. I didn't want to keep doing it. Wasn't sure what I wanted to do. I thought I was going to have to switch groups. And so that was actually when I started talking to Dom's group that was working on magnetics.
Oh, cool.
And started looking into that. And then I also started talking to another group that was working on MEMS devices. MEMS, yeah. So micro electromechanical systems. So basically a combination of like electrical, mechanical systems.
Okay. Quite a mouthful.
Quite a mouthful, yeah. So MEMS. That's what people
better.
say MEMS. Exactly. MEMS is easier.
Got it.
And so got interested in a project with that group and talked to my advisor, and he was like, well, you don't need to work on anything that we're doing. You have a fellowship. I had a fellowship at the time. And he's like, you can do whatever you want.
Nice.
So what do you want to do?
Love that.
And I was like, great. So we came up with a project where I was working on something called field emission devices.
Okay.
So they're effectively, if you go back to the era of like vacuum tubes.
Okay.
Yes.
Okay, great.
So like
Let's
the
go.
1960s.
Okay.
Yeah. Go back to the era of vacuum tubes. They're effectively, the idea behind field emission devices is that you apply a really, really strong electric field to a sharp point, and you can actually emit electrons off that surface.
Like literally a sharp point?
Yeah,
like a
usually
needle?
like a sharp point, like a needle-like point. Yeah.
Okay.
And so the idea between what my advisor was suggesting and this other group that I was working with was to do two things with it: to build high voltage systems and also flying micro robots. That was what my co-advisor. Yeah,
That's
that
cool.
was his dream. Yeah. And he wanted to build ion thrusters for flying micro robots.
All of that sounds fake. I mean, it's awesome.
In theory, it's a thing.
I love that. Yeah,
kind of works.
Yeah, I mean, sure.
So I thought that was super cool, and so
It is.
effectively came up with a project to start working on these field emission devices for these applications.
Okay.
And then I spent the next 5 years basically living in the clean room.
Oh wow.
All of my 20s in the clean room.
It's a great place to spend your
It's a
20s.
great place to be in your 20s.
Yep, love that.
Yep.
Okay.
So that's what I did. And then, yeah, then I already said, like with Dom, I started working with him on another like side project on magnetics, pursuing lots of different things. And then, became a founder after that.
Okay.
And I think like even now today, I think about like how do my research skills translate into how I'm operating as a CEO. And what I do now is I spend a lot of my time, as we're venturing into new areas, I spend a lot of my time trying to learn a little bit about these new fields. And so whether it's neuroscience or machine learning or like circuit design, whatever it may be, I try to spend a little bit of time trying to understand what we need to do and what we need to learn. And then really lean on the experts that we're hiring to educate me and learn with them.
Yeah.
And so I try to do as much learning as I can so I can fluently communicate with them and understand what their needs are and what they're building. But now it's really cool because I have this team of like many different experts in different scientific fields. And so that's really exciting. So I think that that's the part of like the company that I really love in terms of like the research, that we have all these different experts in different fields. And I get to learn a lot from them every day. And that's really exciting.
I think it's a really strong approach to understand what you're leading. But like one of the things I noticed when I first started here is like the range of extremely complex technical components of our system is huge.
It's huge,
It's not just software and hardware. It's
Exactly.
like everything. It's everything in between. So.
We have material scientists, right? We have neuroscientists. We have ASIC designers. We have PCB designers. What else am I missing? Electrical engineers, physicists, right?
Yep. It's a lot. It's a hefty team. And then software.
Signal processing. Software.
We have a product team.
We have
a business development team. We've got it all. Now I'd like to talk a little bit more about Sonera and what we're building here and our products. Can you start off by telling us a little bit about why our approach is different and why that matters?
So there's essentially 3 main factors that make our approach really different.
Okay.
So the first is scalability. So from the very beginning, we wanted to build a technology that could scale. So that means building something with very attractive unit economics.
Love that.
And so we want something that is small, it's easy to integrate in lots of devices, millions, billions of units, something that has low power consumption, something that is cheap at scale. So all those things were factors we paid a lot of attention to in choosing to commercialize this particular technology.
Okay.
So that's one thing. The second is we wanted to reduce the barrier to accessing biomagnetic sensing in general. And so I alluded to this earlier. A lot of the technologies that are used today to read biomagnetic signals they're bulky, they're power hungry, they're expensive, they're just inaccessible. Mm-hmm. They're very high performance technologies that have been used in a lot of clinical settings in very impactful ways, but they're not accessible. And so that was one thing we wanted to do by building something that was a chip, something that can be used non-invasively, integrated into lots of wearables, even consumer wearables. We would reduce barriers to accessing biomagnetic sensing in general. Okay. The other thing that we wanted to pay attention to when it comes to reducing barrier to access, I'm pivoting now a little bit into talking more about brain-computer interfaces, is we wanted to do something non-invasively, something that didn't require surgery in order to, again, reach that larger scale and have that kind of greater impact to a larger swath of the population. Yep. So that's one big difference. And then the third factor that makes us different is, and this is more comparing to other non-invasive technologies or other like consumer neurotech, is that physiological differences just don't matter as much when you're using magnetics as your modality for building a neurotech device. And so what I mean by that is things like hair on the body, other physiological differences like skin color or even like the amount of fat on a skin, that doesn't have as much of an impact when you're reading a magnetic signal versus electrical or optical signals. And so, or even like where you wear it or how tightly you wear it, all those little things that start to matter when you're thinking about real world use of consumer neurotech, that becomes much more viable for a magnetic sensing technology than anything else that exists out there. And so that was also what was attractive to us and makes us different.
Yeah, like sweat and like bands slipping or like not moving in a specific way or not moving at all.
Exactly
those kinds
that.
of things.
Exactly that.
So the through line here is scale.
Yes.
And then kind of like a summary of like, those three different areas is our approach is not, beholden to the barriers that like, traditional magnetics, non-invasive neurotech and invasive neurotech are facing.
Yes.
Which is a pretty powerful combo.
Yes.
Love that.
Very different angle.
Yeah. So what are some of the applications, like make this real for us? What are some of the applications of this technology and like why is it transformative?
Yeah. So I'll start by talking about what we're doing right now.
Perfect.
Today.
Yeah.
Because I think what's really exciting about the current stage of the company is that we're building prototypes that we're shipping to customers next year.
Yeah.
And so what we're doing right now is focusing on reading activity from muscle movement and using that for, there's two applications we're heavily focused on right now. Of course, that may change.
Yeah.
As we know, things always
change. Day over day.
Always change.
Yeah.
But the two we're focusing on are gesture control for augmented reality or virtual reality devices, and then health sensing, things like muscle fatigue. And so what we're doing with it is using our sensors to be able to read the magnetic signals generated by muscle movement, translate that into some kind of digital output, whether it's a health metric or for digital control of augmented reality or these other kind of new interfaces that a lot of people are developing today.
So the health metrics, that's not just from the muscles though, right? That's like heart rate.
Yes.
Pulse rate.
Yes.
Other kinds of like health metrics that all come from the same single chip.
Exactly. Yeah. And so what we're measuring is a biomagnetic signal, right? And as we continue improving our sensor technology, we're going to be able to measure more and more types of signals from the body.
Yeah.
And so right now today, we can look at pulse, we can look at heart, we can look at muscle. And then as we continue developing the technology, the goal is to be able to read brain signals, right? Which is kind of going back to the vision of the company.
Yeah.
And so an example of a future application is imagine doing a very similar thing that we're doing with muscle or heart, but now we're doing it with brain. So imagine putting our sensors into earbuds and then being able to measure cognitive states, for example, or silent speech, like subvocal speech.
Very cool.
There's a lot of really interesting applications that have now been demonstrated with fMRI that I think could apply very readily to the technology we're building.
Yeah.
Once we can get into those form factors and once we hit those sensitivity specs. So that's kind of the North Star and the goal for what we're doing.
Yeah.
All based on the exact same core technology.
Yeah.
So there's like a little bit of this like distinction we make between like the different types of signals we're measuring, but really it's all the same thing.
It's all the same thing.
It's just some signals are weaker than others. And so as we continue improving sensor performance, we'll be able to measure weaker and weaker signals.
Yeah. So two things. I mean, you mentioned, at one point you were considering being a medical device company.
Yes.
The brain applications are, in the medical space are huge. And like very valuable.
Absolutely.
So like we really don't know a lot about, it's hard to know what's going on in the brain. So something like, like neuromodulation or like even monitoring, it's hard to tell if what's working, what's not. So like you could imagine our device being a companion device to other medical technologies that can kind of help, practitioners understand what's going on, like, up here.
Exactly. Yeah. And that kind of gets to this concept of like sensor fusion and using lots of modalities together. I think that's really exciting.
Yeah.
Because now you can take this new data set that we're tapping into, combine it with other modalities, and then there's just a whole bunch more information you can get about the brain and the body by doing that.
Yeah.
And I think what's also really interesting about our technology and approach is that you could use our technology to access this data set over very long periods of time in naturalistic environments. And then that would give you so much more information, alluding to what you were saying about neuromodulation or neuromonitoring, about how different therapies and treatments are affecting people, right, over long periods of time, and not just in clinical settings. So being able to remote monitor patients over a long period of time, I think would be very, very impactful and very, very useful. And so I think that's a really exciting long-term application of our approach.
We've seen data truly transform so many industries.
Yes.
And I think we're really primed for a neuro revolution with data. I think this always on access to whatever part of the brain you put a sensor on is going to teach us so much about what's going on and how we can help people live better lives. Okay, so last question in this little subset of our little talk here. What does the space look like? So, we talked a little bit about, there's magnetics in general, MRIs and other chips, and then there's the non-invasive BCI, and then there's invasive BCI. Talk to me a little bit about how you think about the space.
Yeah, so again, a few different categories here, right? We're kind of intersecting a lot of different types of technologies with what we're doing. It's never so simple. And so the magnetometer space, I've already talked about this a little bit, is a lot of what's out there to measure the types of signals we're interested in is not commercially viable at scale.
Okay.
And so again, we're looking at very bulky machines, power hungry equipment, or things that have to be cryogenically cooled or even heated.
Okay.
And so that becomes just kind of a barrier to access.
Is there anything besides an MRI that I would know of?
So there's something called a magnetoencephalography system, an MEG system, which I think you're a little bit
now
familiar.
I know the acronym now, but I wouldn't be able to regurgitate it.
Yeah, so an MEG system is what's used clinically to detect things like epilepsy or brain tumors.
It's a big thing, or what is it?
It's a big machine. Yeah, it's a giant machine that you go into. It's in a shielded room, needs to be cryogenically cooled. And there are systems like optically pumped magnetometers that are a more scalable version of that in a sense. They need to be heated, but they're not as bulky. They still need to be in a shielded room, so still some barrier to access. But they're a slightly more commercially viable system. They could, be a little bit more scalable for clinical settings. And so it's technologies like that out there. And then there's also other magnetometer technologies that are very scalable, but they're not sensitive enough to be able to detect the type of signals that we're detecting. So we're trying to bridge this gap between very high performance, high sensitivity, but being in a form factor where you could put it into a smartwatch. That's what we're trying to do. So that's kind of what the space looks like in magnetometers.
Exactly the approach for the BCI space. It's the fidelity of invasive with the usability of non-invasive.
Exactly.
So talk about those two little areas too.
Yeah, so the difference between what we're doing and what a lot of invasive companies are doing is, again, we're trying to build something scalable, we want to do it non-invasively, but we also need a really high fidelity signal. We're never going to reach single neuron fidelity, right? And that's not what we're trying to do with our technology.
Right?
Yeah, and we don't need to for a lot of our applications. And I also think that different modalities in neurotech will be important for different applications, right? The application will sort of determine what level of fidelity is needed and what form factor is needed.
Awesome.
And I will add a little thing here, actually, I didn't add earlier, about our technology that also I think can be overlooked just on the surface is because we're building a small chip. If we can put a really dense array of these chips in a small area, you can actually get even more signal and more data out of it by doing that.
Nice.
And so that also, it's a big difference from when we think about electrodes, electrical signals. You can only scale them down so much before you're actually significantly impacting the quality of the signal that you're reading. And so you need a certain amount of surface area in contact with the skin in order to read a decently robust or high quality signal. With our sensors, because they're only a few millimeters on a side.
Tiny.
You can integrate all of these into, again, like wearables that everyone's used to wearing today. You wouldn't even know that they're there.
Yeah.
And you can integrate a lot of them for really high quality signals. So for some applications, you may not need that many sensors and you may not want it. You may want to reduce things like power and not have as many sensors. For some like medical applications, you could imagine putting really high density arrays of sensors into a form factor that somebody wears to monitor something that they're trying to track with their health and get a lot of information out of it.
Yeah.
So I think
It's
that's
very
also
cool.
really interesting.
There's the possibilities are so exciting and so numerous, which is really fun to work on.
Yeah.
So what's next for us?
So what's next for us is we are now building a lot of prototypes that we'll be shipping to our customers. And so that's a really exciting phase of the company. And I think everyone's really thrilled about that. It'll be the first time we'll have external partners actually playing with the systems that we're developing.
Very cool.
And that's also really exciting because we'll get this kind of feedback on how our technology could be useful for their particular application or use case. And I think what will come out of that is not just more clarity on the applications we're pursuing today, but also ideas on what else it could be used for. And I think that's where it gets really interesting.
Yeah.
If you give people a new capability or tool, there's a lot of really cool things that can come out of it. And so that's this phase that I'm really excited about for Sonera.
There's really no substitution for user feedback.
Yeah.
It's really cool.
Absolutely.
Also, the chips themselves are purple, and I think there's no substitution for that either.
Also true.
What do you see, where do you see Sonera in 5 years and then in 10 years?
Okay, so I think in 5 years, where I see Sonera is our technology will be integrated into consumer wearables and expressed in product in a way that changes how people interact with technology. So I'll give the very specific example of like, imagine our sensors are in your smartwatch and you can use that to either control your phone, control your augmented reality glasses in the future, control your earbuds. And you can do this without like having to speak or having to look at a screen or anything like that. Mm-hmm. So that's an example of where I see our technology being really impactful. And you know, a lot of other instances of like our technology actually being expressed in products that are in the market. That's my goal for the next 5 years for Sonera.
Okay.
And then long term, like 10 years out, this one is, I think, a lot more about the data that we're collecting and how this new data set could create a lot of new interesting use cases and applications that aren't feasible today that I don't even know exist, right? Like I have a lot of ideas, but like I don't exactly know where it's going to go because we don't have the data set yet. We know it's going to be rich. It'll be powerful in ways that are different from existing modalities. And so I think 10 years from now, there's going to be a lot more focus on the data that we're collecting and what we can do with that data.
Very
and so this kind of goes back to what I was saying about like collecting these longitudinal data sets in naturalistic environments. What can we do with that when it comes to neuroscience research? What can we do with that when it comes to like product design? I think is an interesting application. Can we change user experience testing based on actually measuring and quantifying what people are experiencing as they're using new devices instead of like surveys or asking questions? Another really interesting example to me is, can we use this as a data set for training models? So that's obviously become a really big topic in artificial intelligence and robotics. Can we use this particular data set measured from humans to be able to train models to behave in a more advanced way or behave more human-like? So that's where I think it gets really interesting 10 years out.
That's so cool. I also really like how you phrased expressed in devices. I think that's a really nice way to put it. That is everything we had for our first talk in the Magnetic Moment series. So that's pretty great. You want to tell people what to expect in the next couple of months from the rest of this lovely series?
Well, what do we expect? Why did we do this?
That's a great question. Why did we do this? I think about every 3 months we're gonna put out another of these talks and talk about things like trends in BCI and more detail about what biomagnetism really is and our sensor technology and why it's scalable, and basically, you know, kind of pick apart this whole talk and really dive deep into the different areas that we kind of just did, you know, I'd say surface level on. So, you know, depending on popularity, you could see as many as 1 or 100 more episodes.
Yeah,
you know?
We'll see how it goes. We'll wing it like we usually do.
So like and reply to get more content and so on. And I think that's it.
People keep asking us what we're doing, so
So
here
now
it
you
is.
can just send a link. It's hard to explain. You can just watch this on 2x speed and Save everybody some
Yep.
time. Awesome.
Okay.
Well,
thank you, Amanda.
Yeah, thank you, Nishita.
Yeah, this was
CEO.
great.
And thank you, Evan, our producer, for
Thank
this
you,
great
Evan.
setup and all the direction. Okay, bye.
Bye.